As still on matters health, the government has stuck to its guns on its no vaccine, no service policy in what seems to be a move to curtail the spread of COVID-19 in the country that has reached a positivity rate of 29.7%. This as health experts warn of continued community transmission and emergence of variants as long as 70% of the population is not vaccinated. And as Gloria Milemu reports, Kenya plans to roll out booster shots from next year.
The no vaccine, no service policy by the government now seems to have taken effect despite a court injunction. The drastic measures by the Ministry of Health now spelling doom for unvaccinated Kenyans who will be locked out from accessing in-government services, among other services.
In public places, all persons must show proof of vaccination for admission, for example, into national parks, game reserves, hotels, bars, restaurants, as well as use of public transport means, including domestic flights, train, and PSVs.
The directive had been suspended by a Nairobi court following a petition by a businessman who termed it tyrannical. The government is, however, seemingly not taking any chances, especially in the wake of the soaring COVID-19 cases in the country.
There's no set date or timeline. The timeline is now, the moment we are in right now, where we are standing, this hour, this minute, this second. And it's important that we understand, and I keep emphasizing, the measures that are being put in place are to protect us all.
Health experts have also warned that the country is not out of the woods yet, and that we should brace ourselves for more waves of infection and emergence of new variants.
So as long as we have never achieved 70% vaccination of our community, we will still have this COVID virus circulating in our communities. And that means that as this virus actually circulates in our communities, there's a possibility of emergence of new variants. So Omicron may actually not be the last variant.
They attribute the variants to circulation of the virus in the community, hence the need to curtail the spread by adhering to the public health protocols and boosting the vaccination coverage.
When the virus is circulating in our community, depending on how we manage our interventions, use of interventions such as vaccination, wearing of masks, social distancing, there's a possibility of having waves coming from time to time.
So far, only 13% of the adult population has been vaccinated in the country, with 3.7 million having been fully vaccinated, as 5.4 million others having been partially vaccinated. Gloria Milemu, KTN News.
Right, let's now take a fast commercial break here on News Hour. When we get back, a lot more stories land up for you, including a lot of questions now emerging on who could have killed a USIU University Don. We have this and more lined up for you. Just stay with us.